Let's focus now on the crisis of this pandemic in Western Canada, because as you can see on that map, Manitoba, Saskatchewan, Alberta, British Columbia, they have some of the highest infection rates in our country, those figures representing the number of active cases for every 100,000 people. New cases, hospitalizations, deaths all continue to rise in many parts of our country, in particularly those western provinces. And so with that, we want to start right now in Alberta and its struggle to contain a surge of infections. The province confirming another record-setting day for new cases of COVID-19, reporting 1,733 new infections, its highest number yet since the pandemic began for Alberta. The province also reporting 8 additional deaths, most of them were seniors. Well, the province's chief medical officer says she is alarmed by those rising case numbers. She's also urging Albertans to continue following public health orders. And for more on what is happening in Alberta, let's go to Natalie Nanowski. She's tracking the very latest for us this morning. Natalie, good morning to you.
Good morning, Michael. So as you mentioned, some troubling numbers coming out of Alberta there with 1,733 new COVID-19 cases in that province, new records as well. In the past 3 days, that province has seen about 5,000 new active COVID-19 cases. There's also about 100 people at this point in the ICU, and many of the cases are centralized in Edmonton and in Calgary. The province is also saying that it does want to increase ICU capacity by adding more beds, and this all comes at a time when cases are expected to rise in that province. And it's also after the Premier has put in place new restrictions limiting the number of people that are allowed in certain indoor and outdoor spaces, also telling children to go back to e-learning. So the doctor in that province, the top doctor, is telling everyone that it is time to buckle down, and she understands that many people are experiencing a roller coaster of emotions at this point. Have a listen.
I know we are all feeling a lot of different emotions about where we are right now. I know this can seem overwhelming, but I need every Albertan to focus on how they can change their lives right now to protect their communities.
Despite this spike in cases, Michael, and an expected increase in hospitalizations, the province says that it is well prepared to deal with the surge in cases. However, some are already pointing to the fact that people are already sharing rooms in some of these intensive care spaces. Michael.
Not only that, there's also doctors right now raising some concern about a memo from Alberta Health Services about oxygen.
Right, and this memo was sent out to doctors and nurses in Calgary, telling them to really limit their use of oxygen and assess whether or not some of their patients can take lower doses. That is the memo that you're seeing right there on the screen. However, the province has come back saying that that memo was just a precaution, that it's not a red flag as some doctors say it is. It's just saying that it does have enough oxygen for people in the province. However, what it is dealing with is making sure that the system to dispense this oxygen is working. The NDP, on the other hand, saw this memo and doesn't think that it is a good sign. It says that it is rather a big red flag. Have a listen.
I find that deeply concerning, that people should be looking to keep people at the lowest level of oxygen possible. That has become a consideration at this point. That should be deeply concerning to anyone. When I see frontline healthcare professionals raising the flag and saying, this is a problem, this is an issue, we should not have had to get to this point, then I think we need to listen to them.
So at this point, the province is saying that, again, it is only an issue with the system that is used to disperse the oxygen, that it does have enough oxygen for the province, and it says that this system is expected to be fully upgraded by June. Michael?
Okay, Natalie, thank you.